Hello, today we're going to be doing a blood transfusion. So the first thing we are going to do is verify our doctor's orders, and we are going to gather our supplies. We have our Y2 blood set, our flush, and our 0.9% normal saline that we gathered from the medication room after we washed our hands. So now we will go and see the patient. Hello, Mr. Sumbum. My name is Adi. Aristea Cavazos, I will be your nurse today. Let me go ahead and wash my hands. Can you please tell me your name and date of birth? Mr. Sumbum, date of birth 12/3 of 75. Okay, so I'm checking that. Now I see you already spoke to Dr. Marcus and he's had talked to you about having a blood transfusion? Yes, he did. Okay. Did he explain the possible risks and the benefits from the blood transfusion? Yes, he did. Okay, and have you understood why you're receiving the blood transfusion? Yes, he did. Okay, so here I have your informed consent. If I can just go ahead and witness that, would that be okay? Yes. Okay, so we're going to go ahead and witness that. Once again, I'm checking my doctor's orders to see what is going to be transfused. So the patient has already had a CBC, BMP, type cross and match, hematocrit and hemoglobin, PT and PTT. The order is calling to transfuse 1 unit of packed red blood cells per protocol. And this is over 4 hours. All right, Mr. Sumbum. So what we're going to go ahead and do is I'm going to go ahead and get you prepped. Then I will go get the blood ready for the blood transfusion. Is that all right? Yes, that's fine. Okay, so let me go ahead and wash my hands. I'm going to put my gloves on. The first thing we want to go ahead and do is assess the IV site. So what we're looking for is any redness, swelling, any signs of infiltration, infection, or phlebitis, any extreme tenderness, which he has none. Okay, and the next thing we're going to go ahead and do is flush the IV to make sure it is working properly. So I have my alcohol swab. We're going to remove the cap, clean the port for 15 seconds. Then I have my flush primed. Open the clamp, attach the flush, draw back to see a little bit of blood. Go ahead and flush. Close our clamp and remove our port. And then we're going to go ahead and get our normal saline set up. Have our Y tubing. Go ahead and open that up. And when we hang our tubing, we want to make sure that all of our clamps are closed. And we're going to go ahead and spike our normal saline. And then we're going to go ahead and prime our tubing. So I'm going to go ahead and open. And we want to fill the chamber a little bit above the filter line before we start priming. Okay, so this is above the filter line. And now we want to go ahead and remove our cap and prime our tubing. Okay, so now that our tubing has been primed, we want to make sure to close our clamps. And we're going to connect this to our patient. So we clean our port for 15 seconds, let it dry, reconnect to our patient. And then we want to set it at a low infusion volume of about 5 mLs per hour just to keep the line open. So then we'll go ahead and take our gloves off and we'll head on over to the blood bank. So we've already gone to the blood bank. We did verify with the technician. We have our order. We did put date, time, who it was issued to, the name of the blood bank technician. We also have verified the patient's name, date of birth, type of blood, blood bank ID number, medical record number, and expiration date for the blood, as well as marking the type of blood that it was, which is the packed red blood cells. So now we're going to go ahead and go back to our room with our patient, and I will bring a second nurse, Nurse Betty, with me to come and verify everything. So come in. All right, Mr. Sumbum, we're going to go ahead and do your blood transfusion. Now, you do not have any allergies to medication, correct? No. Okay, can you just verify your name and date of birth for me again? Mr. Sumbum, date of birth 12/3/75. Okay, so I have Nurse Betty with me, and we're going to go ahead and verify the order together. Okay, so Nurse Betty, we have, this is blood bank ID T8888970. So T8888970. Blood type is B negative, B negative, B negative. MR number D5112599, D152599. Expiration date 10/24/2020, 10/24/2020. Unit number W6895131547588, W6889513147588. So I have verified all of the information with Nurse Betty. I'm going to go ahead and hang my blood. Now, before we start the blood transfusion, what we want to do is go ahead and get a baseline vital signs on the patient, which will include blood pressure, pulse, respirations, oxygen, heart rate. We want to make sure that if the patient does have any type of reaction, we can compare that to the baseline vital signs. So since we are dealing with blood, what I'm going to go ahead and do is wash my hands. And I'll put my new set of gloves on. Okay. And what we want to do is back prime the port. So we'll go ahead and back prime the port. So we want to remove this from the patient. And so before we spike our blood, we will go ahead and back prime our port. So we take our cap off. And you can see where it's back primed. Okay, now we want to go ahead and close our cap off. We can place our cap back on here. Then we'll go ahead and reconnect this to the patient. So once again, we'll clean our port off. Make sure all of our clamps are closed. Reconnect. Now we can go ahead and spike our blood. So we spike our blood and we open our clamps up. Okay, and this will be connected to the IV infusion machine. And so the infusion rate will be set at anywhere from 1 to 5 mLs for the first 15 minutes. Within those first 15 minutes, we will be checking the patient for any potential blood allergy reactions. And so what we will do is, if the patient does not have any allergic reaction, we will go ahead and continue with the remaining 3 hours and 45 minutes of the blood transfusion. If the patient does have a potential blood reaction, the first thing we're going to go ahead and do is stop the infusion, call for assistance, notify the provider. We will then go ahead and remove the blood along with the tubing and the saline line. The blood and the blood tubing will go back to the blood bank. If the patient does not have fluid overload, then we will start a new saline line. Vital signs, like I said, will be measured 15 minutes after the first 15 minutes to compare to baseline vital signs, to make sure that the patient is not having any type of allergic reaction. If the patient completes the transfusion, we will go ahead and use our form where we will list our vital signs before the transfusion, 15 minutes into the transfusion, and after completion of the transfusion. Once the blood transfusion is done, then we will go ahead and submit proper documentation to include the blood transfusion time, blood type, solution that was used, saline, vital signs before, during, and after the transfusion, and what time the transfusion was stopped and what time the transfusion was started. So once we are done, we go ahead and take our gloves off, wash our hands, and dispose of all our necessary equipment. Thank you.